الحمد لله رب العالمين والصلاة والسلام على أشرف المرسلين وعلى آله وصحبه أجمعين. Introduction for Occupational Health by Professor Mahmoud Hani Sulaiman. Occupational health, as defined by International Labour Office (ILO) and World Health Organization (WHO), as promotion and maintenance of highest degree of physical, mental, and social well-being of workers in all occupations. Accordingly, occupational health is keystone for maintenance of working ability of individuals and community. Occupational medicine concerned with treatment of occupational health problems. There is no place for prevention. Industrial medicine is the treatment of health problems related to industries. Occupational health and national development. Developed countries consider occupational health is an integral part in national development. This is because healthy workers equal increased quantity and quality of production by the nation, which equals satisfaction of local and export market, which leads to increased national income and national development. Objectives of occupational health: promotion of workers' health, prevention of health hazards that may affect workers, early detection and proper management of health problems of workers, rehabilitation, physical and psychological rehabilitation. So, promotion of workers' health, prevention of health hazards, early detection and the proper management of health problems of workers, rehabilitation, physical and psychological rehabilitation. Work and health. Work have either negative or positive impact on health. Workers with impaired health are less productive and also can endanger themselves and pose danger to others. Other workers and other individuals in the community. Workers may be affected by occupational exposure. Accordingly, for correct diagnosis of any patient, it is important to ask him about his occupation and exposure before asking him about his complaint. It is important to ask the patient about his occupation and exposure before asking him about his complaint. Etiology of occupational diseases. Occupational disease may be either due to physical agents, chemical agents, biological agents, and psychosocial agents. Physical agents as heat, noise, radiation, vibration, electricity, and so on. Chemical agents as gases, dust, chemicals, and so on. Biological agents, bacteria, viruses, parasites, etc. Psychosocial agents, administration, relation with fellows, shift, work stress, and others. Example of occupational exposure. It may be psychological, physical, chemical, biological. Biological like bacteria, viruses, allergens, and other animals and plants. Chemical, fumes, gases, minerals, drugs, and materials. Physical, materials, other people, noise, heat, radiation, vibration, etc. Psychological, other people, patterns of work, domestic problems, and so on. Definition of occupational diseases are cause specific. They are caused by a specific agent. For example, asbestos, occurring among working population. The exposure may happen at work and they have ended the work or the exposure, but it occurs and appear after leaving the work, like asbestosis and silicosis. Exposure at workplace is essential. The agent is found only in the work, may be notifiable. It is notifiable by the law. If the law did not assume notification, it is not notifiable, but it is still occupational. So it may be notifiable or not, and compensable. If the law is compensating the disease, it is compensable. If the law did not agree on compensation of the disease, it may be not compensable in some countries, but it is still occupational, as they are recognized by law. Example, silicosis and asbestos. These are the very famous examples of occupational disease, silicosis and asbestos. Work-related disease are multifactorial in origin, not only work causing them, like hypertension and diabetes, and many other diseases occurs commonly in community. Exposure at workplace may be a factor, may be notifiable and compensable in some countries. Example, hypertension and asthma. Occupational health team from occupational doctor or physician, occupational nurse, occupational hygienist, psychologist, and or social worker, and others. These are the others. The core staff of the occupational health team are physicians, nurses, nurse practitioners, physician assistants, industrial hygienists, and other clinic staff. Supplementary staff may be physical therapists, health educators, biostatisticians, psychologists, counselors, social workers, health educators, safety engineers, work physiologists, ergonomists, mental health specialists, toxicologists, epidemiologists, biostatisticians, emergency medical technicians. Models for delivery of occupational health services, either company-based or group occupational health services, in which one physician covers many factors or many places, say one day in each place. Hospital and tertiary center-based occupational health services, the physician and the nurse and so on, and the clinic is based in a center, and the workers come to this center. The physician do not go to the factory. Freestanding occupational health clinics, there is a center and it is in any place, free. Occupational health services delivered by primary care physicians. Some occupational health duties may be assigned to the primary health care physician. Occupational health services in countries in transition. Occupational health services delivered in developing countries, like our country. Components of occupational health. It is medical, environmental, ergonomics, and psychosocial. Medical, environmental, ergonomics, and psychosocial. Continued components of medical health, of occupational medical health. The medical one is pre-employment medical examination, periodic medical examination, first aid and management of emergencies, treatment of common disease and casualties, health education, care of workers, nutrition, records and statistics, control of communicable disease. These are the medical, they are done by the physician and the occupational health nurse. Environmental component, periodic monitoring of different types of environmental exposure, for example, air sampling and noise measurement, and assure that exposure at the workplaces do not exceed the allowable levels or concentration, and to advise how to promote working conditions as elimination, ventilation, and housekeeping. This is mainly done by the hygienist. These are some instruments used in environmental measures done by the industrial hygienist or occupational health hygienist. The ergonomics and psychosocial work. Advise how to adapt to work capabilities of the worker and avoid loss of efforts, time, and avoid occurrence of musculoskeletal disorders. done by ergonomists. Advise how to adapt and ameliorate the interpersonal relationship to be cooperative, done by the social worker. In developed countries, psychological work stress is now the most important occupational exposure. In Sweden, the main Institute of Occupational Medicine changed its name to Institute of Working Life. Sample report of clinical activity for an occupational health service. These are some duties done by the occupational health services in a place. Examinations, treatment services, other services. Examination, pre-placement, periodic, idiometric examination, spirometric, and others. Treatment services as for injuries and illnesses and non-occupational injuries or illnesses. Other services as worksite evaluation, health promotion, and other. Prevention of occupational disease. The main aim of preventive measure in occupational health services is to eliminate the hazard. If this is not possible, then try to eliminate the risk. That is to say, eliminate the possibility that the hazard can induce health effects. For example, asbestos is present in a place, remove it and use another material which is not harmful. If it cannot be removed, so eliminate the possibility that asbestos, the hazard, can induce health by segregation, substitution, and so on. Hazards associated with job processes and tasks for use in history taking. As I said before asking him about the present illness, ask him about his occupation. Why? Because this will affect the lab investigation you do for him. It will affect your diagnosis and it will affect your prescription of treatment. I here highlighted some of these exposure. In agriculture, bioaerosol, caustic acids, and other agents causing contact dermatitis. Animal breeding, he may be exposed to allergic animal proteins, bioaerosol, dust, and so on. Here, the complete of this table: automotive body repair and painting, what he is exposed to. He is exposure: paint, aerosol, solvents, isocyanate, epoxy dusts from body fillers and lead. Bakers, khabazin, cement cutting and grinding, ceramic coating, and so on. Here, the exposure of farming and ranching. الفلاحين موجودين في المزارع. Pesticide, wood preservative, bioaerosol, animal derived proteins, grain dust, hydrogen sulfide from manure pits, and decaying organic matter, molds. So farmers may be exposed to this and this may cause harm to them. Firefighting, بتوع المطافي, smoke, dust, carbon monoxide, gases such as hydrogen chloride from burning plastics. Healthcare workers as medical students, general practitioners, lab workers, and so on. There is a special lecture about them will be given. Blood-borne pathogens, tuberculosis, and other many things the healthcare workers are exposed to. Microwave and frequency, pesticide application, solvent degreasing, veterinarians and technicians, Sources and types of information useful for evaluating past exposure. If the worker does not know or does not want to tell you about his exposure, you may get the information about his exposure through these company records, labor union records, government records, insurance company records. This is an example of local exhaust ventilation, in this case used over a lead-generated coolant mist and possible metal dust. This is to be examined and monitored and supervised mainly by the hygienist, but the occupational health physician must know, ask the hygienist if it is working and or not, it is work properly, and when it work properly, for what level of the material will be the worker exposed. Workplace assessments. It is evaluation of workplace to eliminate, as we said, or reduce exposure is critical in achieving aims of occupational health. These tasks are carried out by hygienists who structure their work in terms of recognition, evaluation, and control as follows. Recognition, evaluation, and control. Recognition, evaluation, and control. General principles of occupational hazard recognition. Hazard recognition involves systematic review of workers of occupational environment to identify exposures and potential exposure. It should provide the following types of information. Materials produced or stored and the process. Materials at the end product and process to get them. Raw materials used in this industry. Byproducts during industrial process. Types of industrial equipment. Cycle of operation, frequency of exposure. Work practices, health and safety controls, personal protective equipment used, levels of exposure, duration of worker exposure, number of workers exposed. So when these principles are done, the occupational health doctor can assume what is going to the worker exposed to these hazards. Prevention includes the following, and here I will give you general principles which can be used in any occupational risk according to the situation. So here is general rules for prevention of occupational diseases which can be used in any harmful exposure. First, environmental or engineering and medical measures. Environmental engineering measures. First, substitution, استبدال, substitution of hazardous substance or operation by non-hazardous one, or for example, fiberglass in place of asbestos. Compression instead of hammering. Isolation of the hazardous process inside the workplace so that other surrounding. Continued measures. Segregation of the hazardous process away from the workplaces. For example, incinerators, electric generators, ovens. So these equipments and processes segregated. إبعاد. Ventilation by fans to increase air movement or by exhaust system for suction of toxic gases or dust. Environmental monitoring to assure that exposure at the workplaces do not exceed the allowable levels of concentration. Did not exceed allowable levels of concentration or threshold limit value. TLV, threshold limit value. Assurance of ergonomics in the workplace. place. Then what are the medical measures? Medical measures by the occupational health doctor: pre-employment medical examination, which aims at baseline medical data, to get baseline medical data, to advise worker as regards suitability of the workplace to his health status, and periodic medical examination, which is affected by the type of exposure. This aims at early detection and monitoring of efficiency of occupational health service. Early detection and monitoring of occupational health services. 2 medical measures: personal protective devices to prevent penetration of uncontrolled hazardous exposure into the body of the worker. Nota bene, protective devices must be suitable, comfortable, do not interfere with job continuity, and periodically maintained, otherwise it will not be used. Health education done by the doctor and the nurse. وفي النهاية أقول الحمد لله رب العالمين و thank you for your good listening.